Okay, so all right. Um, the public health indicators, I think, are it's a huge aspect of ecosystem services that we don't yet have in our database. Actually, we use the National Land Cover Data Set for our values. So that means most urban areas are a developed open space or developed, which means they don't even really factor into our valuations. So there's a huge opportunity to factor in public health metrics in spatial terms, and then say what a holistic value of a park is. And of course, I think there's great ways to correlate like impervious surfaces with urban decay, obesity, food deserts, all of these compounded issues, right? Access to open space, mental health, and then use that as a way to actually kind of plot out where new parks should go. Or um, I have lots of ideas, but that's kind of where for Earth Down.
How do we make our places more equitable or more where there's more equal opportunity for people? So it comes into play when someone might be not have good access to healthy food, so that might be a health issue, or they might not be able to walk to school easily in terms of health. So, but also kind of broader economic opportunities in terms of that. So,
My name's Kathy Wolf, and with the University of Washington, and did an early presentation this morning. But one of my research and program interests is health, and interacting with some of the other folks at Earth Economics. There is a database that not a database, it's a series of summaries on a website called Green Cities Good Health, where we've taken the evidence, the published evidence, and generated a series of written pieces that describe what are the consequences of urban residents interacting with parks and open spaces and walkability and active living and all of that. So we're working towards economic valuation and spatial representation of that, but maybe not fast enough for your needs or what you'd like to do with that information. But coming along is what I can say.
My name is Mandy Howard. I work at the City of Seattle Planning Department, and I work on developing policy with respect to defending first use and some of the emergency recovery planning. And I'm interested in the ideas of health and health planning that feed into the kind of.
I'm Christy Heaton. I'm in the PMP GIS program. I'll graduate in August. One of the things that brought me into this program was how you could incorporate health and GIS. Now that I've worked with some of the ecosystem services models, it kind of occurs to me that you can maybe do like ecosystem services kind of evaluation of health, because if you relate it to diseases or even mental health, you can kind of take the valuation in the form of cost savings to the disease kind of prevention or recovery from that, or even in the terms of like mental health professionals.
I'm Sue Costa Kashki, and I just graduated in December, Master's in Architecture. And my thesis was on the therapeutic benefits of public space urban conversations. And I'm mostly focused on mental health. There's a lot of growing momentum in mental health, but I really want to look more at that mental health aspect, especially like middle age kids, because I think that we put a lot of effort into our young kids, and then once they go to high school, they're sort of our cities definitely not set up for that at all. Our culture that we have, young people just aren't used to the, and there's really why they're so I'm just interested. That's what my interest is in right now, and I've actually referenced some of your work in my thesis, so I'd like to talk to you more later. Yeah.
I'm Robert Catherman. I'm a student here at the U, but I'm also a volunteer for Medrix, which is a not-for-profit that works in Vietnam. And we are currently working on a project helping the National Pediatric Hospital assess their patient flow that comes in from the various provinces around. So it has a geospatial component, but it also has highly social component, trying to understand how parents make decisions to take their children immediately to the National Pediatric Hospital and not go to their local care providers. And particularly our area of study is in autism, which is a field that is undergoing a lot of increase in knowledge at this particular point in time. So not sure exactly how all of this fits together, but I do see the spatial component in what's happening in their patient flow, and we're going to try and help them smooth things out and make some changes.
I'm Marina Mednick-Boxman, and I'm a master's student at the School of Public Health at the University of Washington, and expecting to graduate this June. But right now I'm working with the Capital Projects Office at UW, and they are hoping to build a map app that will incorporate not just the exteriors, but also the building floor plans and the interiors. And so I came on to that project hoping to be kind of the wellness layer to this map and incorporate different things like different eating places, maybe identify where the salad bars are, different eating options, and just other things like, for example, resources for bike commuters and like all the different bike lockers that we have on campus. Things are so decentralized. And if there are any commuter showers, things like that for people to use throughout the building, and just a lot of variety of things. Because also they were going to have, by default, have people going up elevators most of the time. So what I'm hoping is that just like they would have an accessibility mode, that they would have a fitness challenge mode that would prioritize stairs and would kind of nudge people toward through identifying themselves as healthy fitness people.
No, actually, what I would like to know is what are the 2 or 3 common threads now that you see? That everyone has introduced the ideas that they came here to talk about. What 2 or 3 common threads would you like to share with the rest of the group once we do a report out?
Well, I think one common thread that I see here is we all have some ideas about what we're looking for, but we have to define some key indicators of how do we get some metrics on what it is we want to do. Greg, I'm thinking about yours. What are the metrics, that you want to measure that you can put into your database? And I think that's a good place for all of us to start, thinking about what those are.
I think another maybe common theme is the question of efficiency. So we're each talking about health at different scales, different applications, and I find that the struggle of being able to put a health outcome or a health benefit as it relates to place at whatever scale has not been well done to this point. And I think it would introduce some efficiencies in how we deliver health services, be they formal or informal, in our communities.
Well, I was just going to say, I think with Obamacare, there's definitely an opportunity that there's going to be a lot more data coming into the system that has been neglected or has been invisible. But just like with ecosystem services, where the beneficiaries live and then where the services are delivered is really important. So if we were going to collect metrics, do we do it on a per capita basis? Do we do it from an insurance company census block group? Do we do it by doctors' offices? And I still don't understand how easy or difficult it is to get data from private sources, from doctors and so on. So, and of course, there's a lot of privacy issues with health information. So, I think sometimes surveys might be a good way to get that data. And really, I think that's really what Earth Economics does. Is if there's a contingency valuation somewhere else in the country, in our database we can use benefit transfer methodology, which is really just like using a comparable in any purchase. If you're going to buy a car or a company's going to buy a car plant, how much is it worth? You might have to look far afield to get a comparison. So I think there's, even if it's not locationally specific, maybe if there's ways that health indicators are related to income and so on, then we can use census data on income or whatever to extrapolate and model what those are. But